Good morning, dear guests of our second PT and EMS symposium at the Köln FIBO. After last year's success, you will get information regarding EMS. You see that the interest is a major one. The hall is full, and you can try it, you can test it, but it's important to know the background information. How do you train? What needs to be taken into consideration? All these questions will be answered by our experts, underscored by studies, exciting topics, and what's so great, you can also ask the speakers. After the presentation, I will come up on stage. Should you have questions, please raise your hands. The speaker will answer them. So we start with the first speaker. It's Jürgen Freiwald, professor at the Bergische University in Wuppertal, and he is head of movement and training sciences and the Research Institute for Performance Diagnostics and Training Consultation. He will talk about the relationship between strength training and science. Well, enjoy the presentation. Come in, take a seat. It's really worthwhile doing so. Enjoy yourselves.
Thank you very much for this excellent introduction. My topic today, the aspects of strength training. I originally wanted to say new aspects of strength training, and I deleted it because you can't reinvent the wheel time and again, but the aspects that do exist and have existed should at least be known. What I'm trying to say is the following. We are familiar with so many esoteric approaches. We should actually focus on the scientific evidence and how to implement it. We call it evidence-based in medicine. Evidence-based practice is what we say in sports. And this is why I will also provide examples for foam rolling or flossing. Is this really evidence-based? Then I will talk about one of the principles that is heatedly disputed, and this is the strain on joints through strength training and the consequences. And to conclude, I will talk about the control of strength training. This is also interesting to talk about these control parameters within the context of EMS to obtain an optimum protein synthesis. First of all, evidence-based medicine and foam rolling. In medicine, we use this term evidence-based for something that is clearly evidenced. And in sports, also from the Anglo-American region, we speak of evidence-based practice. In other words, everything we do in practice is to be based on evidence, on studies, study results, and on the corresponding proof, scientific proof or evidence. So, first of all, we have to ask an important question. Do we want to build up muscles, or do we want to strengthen the connective tissue for rehabilitation? Do we want to train fascia or trigger myofascial structures? Then we look at the databases, Medline, Cochrane, Petro, all of the databases available. Then we try to rate the evidence for a specific training measure. Then we integrate the training measure into our practical application and then re-evaluate the evidence. We make sure that it works and whether it works. We know that we have integrated many practices in our surgeries which actually proved not very helpful and even detrimental at the end of the day. This is a wonderful book published in 2016 by Amonet. Evidence-Based Practice in Exercise Science. This is the first book available worldwide on this topic. And the author says that there is a lot of misinformation in the fitness field. For instance, the diet because protein is so in right now. This is the hottest ticket. I looked after two football clubs, Hannover 96 and Schalke 04. Two I saved because they were about to leave the National League because they were so keen on eating proteins and very little carbohydrates, which is fatal for a football player. Then there's lots of theory about programs, the strain parameters, but I will talk about this. What do we want to do? Well, we want to part with the esoteric approach from the commercial approach. We want to move towards evidence-based training measures. And in the US, the National Society of Sports Medicine has actually looked at this, publishes books and manuals describing what is useful for what and what is the evidence for which field. And I looked at foam rolling in this context. What do we know about foam rolling? That's simple. Stretching has been discussed for years now, has been studied many, many times over. 1.0 means no effectivity. No effect. In the forest block, it was effective. Stretching to avoid injuries does not work, full stop. And we've looked at this for decades. But when you then look at strength training in green, the smaller square means that we have fewer participants in studies, but there's a clear evidence saying that with strength training in competitive sports, you can reduce injuries. In between, we've got the so-called proprioceptive training or combined programs, somewhere in between. So a strength training prevents clearly injuries, and it's good that way. Stretching doesn't do this. So if I'm in fitness and say, well, you have to do stretching to avoid injuries, sports injuries, then this is incompetent. You have to be very frank about this. Stretching is important, but especially in therapy or in isolated cases when the trainee suffers from a particular disorder or problem, but not in general. And when I talk about back pain, I will talk about this in more detail. The most stupid sentence I hear is, muscles help to take strain off the joints. Well, you must have failed in primary school already if you say so. This is one of the basic principles of Newton's laws. Action equals reaction. If I flex muscles and I use my joint, then this joint is compressed very easily. Or if you're out of the center of gravity, then you have this turning action. So how is the torso and the extremities to take off burden of a joint? This is impossible. But I hear it time and again. This is basic primary school knowledge, and I wonder why this is always miscommunicated time and again. Very easy. I don't want to explain this. This is force vectors that you can easily apply to clarify this. We also use this for osteoporosis patients. Through strength training, we want to place a burden on the bones and on the joints. You know this. And if, for instance, we're in outer space without gravity, then we have a very strong osteoporosis because the compression and the strength parameters decrease. And this is what we don't want to have. So EMS could be very helpful in outer space. I hope that it does not consume too much power. But if so, you could actually use EMS very well, but not to put burden off the joints, but to actually stress and strain the joints. An example, I take a flask of coffee with a shoulder prosthesis. Just imagine, and I lift 1.4 kilograms and put it down again, this flask. In the shoulder joint, you have those pressure receptors. The pressure receptors stands at 100% of body weight. So if I weigh 80 kilograms and I lift a 1.4 kilo heavy flask, I have a compression of 80 kilograms acting on my shoulder joint. Please tell me now, how is this supposed to work? That muscles actually take off a burden burden of joints. And you see the problem. As soon as you have a joint problem, a cruciate ligament, you don't have more muscles, but you have a problem in building muscles because you're putting a strain on your joint. Same with cartilage. Rehabilitation. This is a mosaic plastics. It's a graft. You actually punch out cartilage blocks to replace a gum. If I'm in a leg press, for instance, how much power do I really have on this cartilage? Does it help or does it damage me? If I actually walk downstairs, then of course the load is higher, and this does not take load of my joint. So in other words, the joints in this configuration, here the femur, this is the cruciate ligament, the femur, and here, this is where we've taken out the cartilage from an area not under stress. So if I do strength training, I have to know whether my joints will actually stand the burden. And my joints actually tell me so. Think of the mustus medialis. Everybody knows after a cruciate ligament disorder, this is suffers from an atrophy, but it does not become atrophic because it's nice. But the atrophy happens because the joint cannot absorb any burden because the muscle actually pulls inwards exactly where the cruciate ligament is no longer in existence, and this is why there is an obstacle to this movement. Nature, of course, does not know that we have a possibility today to use EMS or actually operate the patient. If I, for instance, have an operation and I have a joint, the joint replacement that can be placed under a biomechanical load with a replacement cruciate ligament, then with EMS or classical rehabilitation measures, we could build up the muscles again because the body gives us this feedback. Everything is gone and rotten, but the fact is that you can actually place some biomechanic load on it. This is basic knowledge, and it should be factored in. There are many myths about strength training, and one myth is the myth of the core stability. Do you remember the Americans when they promoted the core stability? When you look after sports people for many, many years, you know that this has always been important. In the early days, we talked about torso stability training. Today, you call it core stability training, but the training as such has not changed. Body or torso stability is, of course, important for all types of extremities, for football players, for instance. But when you take a closer look and what is interpreted into it, then you have lots of myths. And when you please read international literature, because you don't find this in German literature. Maybe in 20 years we'll find it in German literature. Foam rolling, same thing. There's a few micrometer thick layer that we actually roller and expect it to change. Nice idea. But here again, a publisher of this journal helped us to study these myths, and unfortunately, there's a little truth left in it. If you like to read this publication, last year in 2016, this was the most often read scientific publication because foam roller is so in. So these are the expectations. I have just actually taken the expectations from serious publications, and I'll briefly talk about the red ones. Let's talk about warming up and in promoting blood flow. Forget about it. A warm-up program is always better than foam rolling. Improving strength and jump performance. Well, if you do foam rolling, then you have a reduced jump height, not a higher jump height. Then improving anaerobic capacity. I don't know how people came up with this idea to study it. But eat ATP, lactocytes, what are these metabolic processes to do with foam rolling? So, of course, there is no positive nor negative impact. Flexibility, I won't talk about that, but flexibility is increased, dexterity is increased, but not as strongly as by a regular stretching. If you do it add-on, fine, I've got added benefits. Then sensomotoric functions don't change at all. Stress, relaxation, regeneration, there are evidences, but only in one area. And this means a faster regeneration after sore muscles. We don't know why. But cortisol, testosterone, the stress markers are actually unimpressed by foam rolling. And here again, muscle and connective tissue toning, maximum 14 minutes after foam rolling. So you have to be on the pitch quickly, otherwise the effect is gone. Within 14 minutes, the effect of foam rolling is gone. This is an example. The blue group is the control group. They haven't done anything. The green one are cycling, and these trainees had a foam rolling. So this was the pre-study status quo. After cycling, you can see the warm-up effect, higher jump height. After foam rolling, you see a slightly lower jump height, but it is a permanent change. In other words, it relaxes ever so well, foam rolling, but it is not suited to actually prepare your competitive athlete and increase performance. With such a device, we can actually measure the muscle tone, and here we can also say that there is a slight reduction of toning, but only a very slight reduction, because we have to distinguish between the electrical tone and the connective tissue resistance, which is a mechanical tone. We can only measure the mechanical tone with this device, and this remains almost unchanged. But now the question is, what happens through such exercises, such as foam rolling? And I'm almost upset. I'm really angry, because in medicine, it takes us 10 years to approve a new drug. But everyone is allowed to actually launch a new method without the new methods being tested. The triads, for instance, with a venous artery, a lymph system, and the nervous, they go through the connective tissue, and I roll over it. Who's a physiotherapist here in the audience? Great. What have you learned when you were a beginner? How do you massage? What's the body, or always towards the body center? Who does lymphology? Anyone? How do you do that? To the heart, of course. Soft or hard? Soft, of course. Everyone knows this. And now, all of a sudden, you enter such a course, and you're forced to actually cast away all of your beginner's knowledge, everything you've learned, and you do it back and forth with 10 times the compressive strength in class 4, 10 times that is allowed, and the 3 times the compression that actually cuts off the supply. We do not know what the long-term effects are, but we can see the first problems. This is a harder connective tissue after 3 to 4 years. When you do some handicrafts, for instance, some dexterous, that you get a harder skin. But the same effect is when you do this for 3 or 4 years. We had a big research project that we applied for, and the venous flaps, the valves, can be seen under the Doppler laser. So they flap into the wrong direction. What happens? The venous valves are not actually flipping towards the heart, but the other way around, because I have this lymphous liquidity that is flowing through them. What this does in the long term, I don't know, but we already see many young people today with varicose veins today. What I am trying to say is the following. Like in power training or strength training, for foam rolling, you need to have the right indication. Not everything is bad. EMS is also heatedly disputed, but there are indications that are ever so well suited. And we have to identify these to help people rather than damage them. Let's talk about strength training briefly, and we can be very brief here in terms of effectivity. The question is always one or multiple set strength training. Before the NFL season, for soccer, in the National League season, we do multiple sets in the run-up to the season and simple sets during the season. Because with the multiple set, you can build power and promote strength, and you can sustain it with 1 or 2 sets during the week, during the season. These are the results, international results we've obtained for a comparison. Red means a single set. This is effective, but the multiple sets are more effective. And now, in the fitness area, there are additional aspects such as calorie consumption. So if somebody wanted to lose weight and promote calorie expenditure, then you should have several sets, but you should not bend over the equipment like a banana. 1.9 calories in one fat, from carbohydrates 1.4, which is stupid to actually promote my fat metabolism, because the training is highly effective in fat metabolism. And for hours, you will hang over the stepper in the morning, ladies thinking they're doing something wonderful, they would lose their fat. Yes, they're using their fats, but they're not burning calories, because fat metabolism is highly economical. If you really want to lose weight, you have train hard lacticide to burn energy. There is no other way to burn more energy in a short amount of time. Then the strain density. Here, 1 minute, 2 minutes, and 3 minutes of break for both men and women. And we then look at the performance output. And the longer the break, the more calories can be consumed. So in line with wattage. If you want to lose, you have to actually introduce longer breaks, very simply. You probably even have to allow for longer breaks if you're in handball, in basketball, or in football, because only then you create the perfect setting. But when you actually run through the sets of equipment in the morning or in the afternoon, well, so what? Try to be versatile. So whether it's 3 or 5% is of no importance for you. Then lactate accumulation. That's another topic. Many things have changed in terms of use. Lactate is a signal molecule. This is not a waste product. It is an interim metabolic product which also heals cell membranes and connective tissue disorders. It is really important. Lactate. When I have a high lactate value, we have football players at the lab, and I'm always happy to see a high lactate value when they want to play in the Champions League. Why? Because the lactate is no longer in the muscle cell, but in their blood. And secondly, if you have a high lactate level, then they ideally fit the challenge profile of the Champions League, because 160 to 180 kilometers of acceleration is needed per match. But this cannot be achieved with changing the fat metabolism. A football player has to produce 2,200 watts to actually jump up half a meter, and you can't use fat for that. Only the adenosine triphosphate. So this needs to be trained, lactate. And this is why I'm so happy to find high lactate levels, because they help the high-speed muscle twitching. They're not endurance focused, which is not necessary for football players. This is a little more than leisure golf, but they can play the Champions League because they don't simply need it. If you actually count trees and run through the forest as a football player, you must be crazy, because you're bringing down your performance. And again, there are various types of training available. For bodybuilding, for instance, they work with high levels of lactate until they vomit, basically. Then cheated reps and so on. This lactate is a molecule, and they do the right thing because there are two aspects to promote protein synthesis. First of all, the mechanic connection, or high loads, that is, and secondly, the over acidification. That actually triggers a lot of processes, which then actually entails a perfect muscle adaptation. So the bodybuilders do it right when we want protein synthesis. Just look at powerlifting, Olympic style. They do the same right thing, but they have another objective in their training. So depending on the training method and your training objective, and you can find this in literature very, very well. You can read my book, which was published in 2016, Optimal Strength Training, and it contains all of these results. So I'm selling you my own shop window here. So you can look up what lactate levels are perfect for the various training settings. Then intensity and protein synthesis rates. That's an interesting question. We have cartilage damages, for instance. How do I get a big muscle? EMS is one way of doing it, but the other way of achieving it is this. If in only 30% of the maximum load work until I'm really exhausted, I actually put a burden on the muscles, but not on the joints. I can also do it at 90% until exhaustion. And the question is, what is the biosynthesis, the protein synthesis resulting? After 4 hours, it's comparable levels, but after 24 hours, the low-intensity training until exhaustion has a higher protein synthesis. The results were produced by Toigo in Switzerland. He is doing a wonderful job, and he's also written a wonderful book on on strength training. It is called Muscle Revolution. The title is stupid, but the content is great. So this means when I have an injury or I suffer from osteoporosis as a patient, then I have to reduce the intensity but work out until I'm fully exhausted. And then I have the same protein synthesis that I would actually achieve with a higher intensity. Again, the aspect is how long do I have to expose my muscle to a burden or a strain? And that's the problem in Germany. You only look at repetitions, breaks, and intensity, so the resistance relative to the maximum of repetitions. The repetition maximum is important, you have to measure it, but there are more parameters that are more important. For instance, this is the Toigo book, again, Muscle Revolution. How long does a muscle have to be flexed to have optimum protein synthesis? If you take a butterfly, for instance, from 120 degrees and to the front, and you do it very slowly and do 10 repetitions, then you have the optimum between 90 of 120 seconds time under tension. For muscles. Take the butterfly and you only do 60 degrees, but do it quickly, 10 repetitions, same breaks, same resistance. You have failed miserably. You probably only have 20 to 40 seconds time under tension, and you failed. So please do not only focus on the intensity and the number of repetitions, range of movement should be factored in, and take a clock and stop the time, 90 to 120 seconds of time under tension. Because after these 120 milliseconds, you have the optimum protein synthesis. And this is why bodybuilders have a long time under tension. They know this, maybe even intuitively. What's interesting now is when you look at the time under tension, then you have the slow twitch when you go for low weight. because you can't do this for 120 seconds. Then the fast twitches in the and the fast twitches X at the very end. This is a great training to build up muscles. But if I did this with a football player, he would actually reduce his speed, because in terms of control, you get the slow ones and the quick ones at the end. But you need explosive high speed. So you need high frequency control. So here, again, this is tricky. But for the fitness and leisure segment, 120 milliseconds or seconds of time under tension. Age also plays an important role. It's nice for me. At age 60, I still have a very nice adaptation when I train. So I also have to do my training. But what's nice for me, I have to invest a lower intensity. So my optimum is at 60%. This is my repetition max. The competitive athlete actually needs 75 to 90%, the well-trained young athlete. It's good for me. So when you have older club users, you can actually lower the intensity because there's nothing happening at the end. Because aged 50 plus, but when you're at 60%, you can actually move mountains. That's important. For the young athletic guys, you're in the area of the bodybuilders again, because they intuitively feel, I need more here and I need more time. I do it slowly across the entire range. What about regeneration now? What's important, people that do not train, don't adapt well, but they take a long, long time for regeneration. So with training, 2 training sets, for those people, you're doing fine. Don't make the mistake to start with 4 sessions. This will only put them off. But sooner or later, when they're more adapted, you have to increase the number of sets. When you're in competitive sports, then of course, the regeneration is so fast. A bodybuilder is fully regenerated after only 48 hours. In football, the regular strength training, they regenerate within as little as 24 hours. On Sunday morning at 10, we do strength training for the European team, and the regeneration is fantastic for professional football players. Then metabolism and sports discipline. This is the last 3 charts. This is my time because we had the technical problems. As I said, football players have 160 to 200 accelerations. What about the metabolism now? Anaerobic and lactocyte, 65%. Anaerobic glycolysis, 32%, and anaerobic glycolysis, 3%. This is facts. You can measure this. But let's go for a strain of or tension of 6 seconds. We're at 8% aerobic and anaerobic 41%. Knowing this and training people, like a football player, for instance, then I take a different approach. I ask, how much energy do I need? If I do a head ball or a spin, then I need between 4,000 and 6,000 joule per second. So what is the metabolic area that I can produce this? This is the anaerobic threshold. Cycling, for instance, 450. So you know, this is Tour de France-like. This is what you can actually produce through fat metabolism, but not more. So, but if you play football, basketball, or volleyball, or handball, then you have to be up here. And now you can actually measure the time. 1 second, 10 seconds, 20 seconds. In a sprint, 5 meters, 100 meters. And at the bottom, you can also look at strength training. 1 repetition, 6 repetitions. Where do I stand now? This graph is also in my book, Optimal Strength Training. This gives you a guidance, after all, which type of metabolism is triggered. And when you really want to train in a discipline-specific manner, then this is the way to go, and your sports people will be happy. Thank you very much for your attention.